Hello, I'm Dr. Hodkin. In this video, I'll talk about the symptoms of flashes and floaters. I assume you're watching this video because you're concerned with new spots floating in your vision or seeing flashes of light or both. To help explain about this, I'll first review a little about the anatomy of the eye, and I think this is best explained by following a light beam as it enters your eye. The light enters the clear front surface of the eye called the cornea, which does most of the focusing of light. It then passes through the central colored part of the eye called the pupil, which controls the amount of light entering the eye. Your pupil will be dilated with drops in order to perform a thorough eye exam. It then goes through the lens of the eye, which, along with the cornea, helps to focus the light. By the way, when the lens becomes cloudy with age, it's known as a cataract. You may have had cataract surgery in the past, since this can be a risk factor for flashes and floaters. Finally, the light ends up focused on the back of the eye onto the light-sensitive retina. The very back portion of the retina is called the macula, and this is where macular degeneration can occur. You may have heard that term before. The middle portion of the eye contains a jelly-like substance known as vitreous. It's similar to raw egg white, and it fills the eye just like egg white fills an egg. It's important to realize that the vitreous is attached to the retina at various points, mostly in the periphery and also where the optic nerve enters the eye. The vitreous consists of proteins such as collagen, as well as hyaluronic acid and water. With age, the vitreous starts to partially break down, liquefy, and contract. During this process, the collagen fibers clump together so you end up with solid particles floating in the liquid. When light enters the eye, these particles cast a shadow onto the retina and are seen as spots floating around. Folks often describe them as cobwebs or hairs. Even though the floaters are always there, the lighting conditions around you make a big difference in how noticeable the floaters are. In other words, your floaters would be much more noticeable when looking at the bright blue sky, a computer screen, or a light-colored wall. However, you may not notice them in a dimly lit room. These age-related floaters that I've just described usually come on slowly with time, increasing in number as the years go by. However, a sudden increase in floaters is more concerning, which I'll discuss in a moment. The other problem that the shrinking vitreous can cause is pulling on the retina. Remember that I mentioned that the vitreous is attached to the retina at several places. If the vitreous tugs and separates from these attachment points, the retina is stimulated to send signals to your brain which appear to you as flashes of light. I've had these myself, and I describe them as seeing fireflies in my side vision. If the vitreous separation from the retina is strong or sudden enough, it can cause the sudden appearance of one or two very large floaters, often in the shape of a ring. Fortunately, with time, gravity tends to pull these floaters down out of the way of your center vision. About 10% of the time, a sudden vitreous separation can cause a tear in the retina. In this case, the floaters may actually be blood. This is a more serious condition which, if not treated, can lead to the retina coming off the back of the eye. To review, the sudden appearance of new floaters in your vision can either be from small scraps of vitreous left behind or blood from a torn retinal blood vessel, or both. These are often associated with flashes of light. Therefore, the main reason to get an eye exam is to make sure that the retina has not been torn by the tug from the vitreous. The separation of the vitreous from the retina is formally called a vitreous detachment and is actually very common in middle-aged and older folks. This is to be distinguished from a retinal detachment, which is much more concerning. Vitreous detachments are even more common in people who are nearsighted because the eye is stretched and elongated, or who have had cataract surgery or other eye surgery. It can also be caused by trauma to the eye or head. In other words, anything that causes the vitreous to forcefully jiggle around inside the eye can cause the vitreous to separate from the retina. The good news is that about 90% of vitreous detachments are harmless, though, as mentioned, about 10% result in retinal tears. If a retinal tear is found, it is usually treated with a laser that can spot weld around the tear to prevent the retina from detaching from the wall of the eye. It's important to note that a complete vitreous detachment can take weeks to months to occur, and that occasional flashes can be seen during this process. Once the vitreous completely separates from the retina, the flashing will stop. So even if no retinal problems are found at your exam today, it may be necessary for additional exams in the future if the symptoms change or become more dramatic. So you should call immediately if you have an increase in flashes or floaters, since this can mean that the problem is progressing. Also note that the other eye is very likely to have the same issue within a year or two. Please ask any questions you may still have during your exam, and thanks for your time and attention.